Welcome, everyone, to the DCR Out Loud. My name is Tara McKinney, and I'm the Public Outreach Director of the Division of Cannabis Regulation. I am here today with our very own Shayna Arndt. Hi, Shayna. Happy New Year.
Tara. Happy New Year.
It's 2025.
Oh, we made it. Oh, just barely. I'm Shayna Arndt. I'm the Deputy Director for the Section for Patient and Application Services, and most recently, the world's okayest snow shoveler since we've been stuck inside.
Yeah, weather's been a little wild. I think they actually called it a blizzard. But Missouri is like not
blizzard territory,
Yeah.
technically.
Yeah, so.
Yeah. Well, they do say, just wait a day and it'll change, but I think it's every day now something different.
Yeah.
Ride the wave. Happy winter.
Exactly. I'm so glad to be here with you, starting things off in the new year. How have you been?
Oh, good. I'm so glad that the holidays were over. It was so nice to spend time with family, but I think I'm ready to get back to our regular programming. How about you?
Yeah, that's the same. I've been out for the holidays, and then we had the additional snow days, and it's like,
Right.
I just want a normal week where we just,
Right.
come to work every day.
Right.
Surprise, surprise. Now in 2 months, I'll be like, where's our holiday at?
Right. But for the time being, it's like, we're 2 weeks into January. Can we just get back to normal?
Yeah, right.
Well, this is a good start, though.
Yeah, exactly. So let's get to it. So in this episode, we are going to talk about agent IDs and the fingerprint submissions. And we will have Lindsey Roots in the No Zone talking about CANNRA and discussing what we learned at the annual conference this past December. We'll round it out with some general updates and take it from there. So, Shayna, you ready to go?
I'm buckled in. All of my devices are in airplane mode. Let's do this.
Let's do it. So we're going to start off by talking about agent IDs and the fingerprint background screening. I know that we started resuming the agent ID application fingerprint submission requirement on December 2nd, and now individuals with ownership in a licensed facility will resume beginning January 15th, 2025. These processes happen right within your own section. Can you tell us a little bit more about it?
I sure can. And that's right. It is housed within the section that I'm in. And the area of rule, I'm going to throw a citation at you. So it's 19 CSR 100-1, section 0702E. It states that all agent ID applicants must submit fingerprints for both state and federal criminal background checks in order to screen for disqualifying felony offenses. So we did kick off that for new and renewing agent ID applicants on December 2nd. And so far, it's going really well. It is different than what we've been doing for the past 2 years now that we have that FBI authority to conduct those background checks. A few changes in our process to where the applicant will send in the application, and then we will reach out to them to say, hey, here's how you submit fingerprints, and give them everything they need to get that done within the 14 days outlined in the rule. So that's new and renewing agent ID applicants specifically, but we actually have 3 impacted groups here that are going to be asked for fingerprint submissions so we can conduct background checks. So like we mentioned, new and renewing agent ID applicants, and that is going to be consistent going forward. And then we also have a group that we're calling active agent ID card holders, and those were folks that were issued an ID card but at the time not required to submit fingerprints. There is an attestation in their application that we would ask them for that once we had the authority to do so. So we're going to take that one batch at a time, starting with folks that were approved in December 2022 through January of 2023. If someone out there listening is an impacted agent in that group, sit tight. We're going to send you an email to get things started. We don't ask that anybody does anything ahead of us letting them know, because we have a 4-digit code that we're not going to share publicly because it does specifically go to our access of fingerprints. So we don't want fingerprints submitted that aren't for an application that we have. And then the third group that's impacted, which you mentioned in the intro, is the owners of licensed facilities. That group is going to be starting to get requests for fingerprints starting January 15th. That process is going to go a little bit different, but the same rule still applies, that an owner of a facility can't have a disqualifying felony offense on their background.
I just want to mention that owners will be processed by Bureau of Licensing Services, so those communications will come from them. Just to be clear, this isn't a new process. This is something that we were doing
right
before, just when we switched over to Section 2 or Section 2 got approved, we had to get that authority.
Right. Our FBI.
Or not re-get, but
our authority from the FBI was only under Section 1. So now that we have Section 2, we had to update that authority to cover all of our new rules.
Than re-get.
Right. And so it's not new as much as it is reinstating a process that we did under medical. So yeah.
Let's just recap on those important dates. So if you are a new or renewing,
yeah.
that requirement started December 2nd.
Yes.
Right?
So that's effective now.
Okay. And then if you are an active agent ID that had never gotten background screened before, you'll be starting to reach out to them
early February.
We're
finalizing processes right now because we want to make sure that we're not having a huge impact on our day-to-day business or the licensee's day-to-day business, since agents are the folks that work in the facilities. So we're finalizing our plans, making sure that we are doing everything we can to make this as smooth as possible for all involved. So early February for those folks will start reaching out directly.
And what are those dates again? That was December.
Yeah, we're starting with the active agents that were initially approved when the rule first changed, December 2022 through January of 23. And there are about 2 years worth of active agent ID holders that will need to do this, but we're just going to start with that first 2 months. And then once we get through that batch, we'll move to the next time frame of active agents.
And so really the main takeaway is if you are an agent ID, we'll contact you.
Yes.
You don't have to do anything. Sit tight. Be looking in that email for us to reach out to you.
Right.
You're going to get those backgrounds. You're going to get that background screening request, and then you'll have to follow the instructions.
Yes.
Or need to follow the instructions for that.
And I think a couple of important reminders if you are an agent ID holder or you're going to apply for one is make sure that your email address is correct in your account. When you log into the Complia website, our online registry portal, make sure that the email address that you use to log in and the one that's in your approved ID card is accurate, because that's how we'll reach out. Even if you are a new applicant, go ahead and send that application in. And if you're active, don't do anything. We'll reach out to you from one of the health.mo.gov public intake email addresses to get that started. We'll give you everything you need. And then there's 14 days from the time that you get the email to submit those prints.
If people have questions or need to stay informed, can you tell us the best way for them to do that?
Oh my gosh, we have so many good resources. So first of all, the newsletter, that's going to have some good information in it. We keep the website updated with everything as it comes out. So I'd say check back to cannabis.mo.gov. The agent ID how to apply page will have more information on it than the landing page, but there will be announcements on both. I'd say if you have outstanding questions that, the information on the website doesn't answer, give the call center a call, talk to one of our staff. They'll be able to answer questions, talk through the information on the website, and generally just guide on how the process is going to go. So we're here. We want to make sure the information's available. So please don't hesitate to reach out if you have other questions. And I know we say it at the end, but the phone number for the call center is 866-219-0165, and that's available Monday through Friday, 9 a.m. to 4 p.m.
All right. Thank you so much, Shayna, for giving us an overview of that.
It's about that time.
It's time
for the No Zone, our monthly segment to keep you in the know. This month, Lindsey will be talking about CANNRA. Take it away, Lindsey.
Thanks, Shayna. Hi, my name's Lindsey Roots, and this month we're going to be talking about CANNRA. CANNRA is a nonpartisan association of government agencies involved in cannabis and cannabinoid regulation. Their mission is to convene, educate, and support governmental jurisdictions responsible for implementing cannabis and cannabinoid policies and regulations. CANNRA accomplishes this by fostering collaboration and coordination to identify and share best practices that safeguard public health and consumer safety, promote equity, and create regulatory certainty for industry participants. CANNRA members include the primary cannabis and/or hemp regulatory agencies and other government agencies involved in cannabis policy implementation in more than 45 states, the District of Columbia, 2 U.S. territories, Canada, the Netherlands, Malta, and Albania. CANNRA has several subcommittees within the organization that DCR staff uses as resources and to learn from other states. Some of these subcommittees include social and economic equity, public education and stakeholder engagement, compliance and enforcement, lab testing, as well as product safety, banking and finance, and much more. CANNRA holds 2 annual meetings each year. One is for stakeholder engagement that focuses on bringing the industry and regulators together. The meeting this year that focuses on stakeholder engagement will be in June of 2025. The other meeting is for government regulators only to share new approaches being taken in their jurisdictions and troubleshoot challenging policy and regulatory areas. This meeting is typically held in December. In fact, several DCR staff attended and contributed to this conference.
CANNRA is always an excellent resource for us here at the division, and the conference is a great opportunity to meet other regulators from different states. Each state has its own set of rules and authority, so it's really interesting to see how others are navigating this growing industry. Lindsey, you serve on one of the panels. Can you tell us a little bit about that?
Of course. This year, we talked a little bit about recalls on the panel that I served on. And in that discussion, it was really interesting to see and discuss the challenges as well as some of the benefits of communication and sharing those different communication paths with the recall process. I know that, for example, we actually shared a lot of our documentation that we use for our notifications with other state regulators. And they were really excited to not only have that resource to see kind of how we approach that communication to not only our industry stakeholders, but also our public stakeholders, because they're also being affected in this process. They may or may not have a product on recall. How do we get that message out? And so here in Missouri, we have opted to kind of troubleshoot it from a few different angles to get that message out there. We do have our newsletter that will send anyone who is signed up for that will receive that messaging around a recall. We also will be reaching out to designated contacts in our industry's facilities, making them aware not only of, hey, this is happening, but we'll even give them a heads up that this is happening to you, and provide them with a itemized list of the items that have been placed on recall in their facility. So really trying a multi-prong approach is something that Missouri has taken. And it's really interesting, and it's really fulfilling to be able to share how we have done that and also receive feedback from other states and get other ideas on not only how to continue this process, but make this process better and expand that reach in the future.
Yeah. And that last bit, I felt that from all of the panels. I was lucky enough to go this year. I actually sat in on your panel, and it was so interesting to see other faces in the audience, knowing that we were information sharing and that we're in this together. It's nice to hear from other states too, where
our peers.
Yeah, it's nice to hear from our peers in other states that we are trying to accomplish the same thing and we're headed the same way, but our paths to get there are very different. I even felt that from there was a talk about different states' medical programs and how different legislation has impacted that, different rule changes. I feel more enlightened and come away with better ideas for, how we can better discharge our duties. And interesting enough, our director, Amy Moore, is also a board member of CANNRA. Is that right?
Yeah, she is. So not only does she attend these 2 meetings each year, but she's also really active in planning and working in a lot of these individual committees and bringing CANNRA and all of these regulators together and really helping with, troubleshooting and breaking down some of those barriers with communication and really spearheading engagement of this group.
Going back to all of our states have different authorities. They have different rules, regulations. And so it's just so interesting to hear from all the other states. And that's really all we have when it comes to cannabis, because it's such a new industry that really having CANNRA and having other states to kind of bounce things off of and see how they did it and be like, oh yeah, we're going to do it that way, or no.
That didn't go so well for them, so we'll go another way.
Yeah.
Interesting too how each group within the state is classified differently. We're in Department of Health and Senior Services. Yeah. Sometimes they're embedded with public safety, the ATF, kind of depends on the state. Sometimes they're their own freestanding department.
Right.
So even that point of view is really helpful.
Mm-hmm.
Yeah. Like you said, there are a lot of states where they are very segmented in what they regulate. Right. And so, I know that we are a kind of an anomaly in some regards of having everything under one house.
Yeah.
Which, I'm biased, but I like it.
Other topics included product safety, human trafficking in the illicit market, litigation trends, sale and traceability systems, federal policy, and much more.
If you're interested in more information about CANNRA, you can visit their website at CANNRA.org, and I'm going to spell that out for us. It's CANN-RA.org. Thank you so much, Lindsey.
Thanks, Lindsey.
See you next month.
See you next month.
And now it's time for some licensee updates. The annual microbusiness report was published on December 23rd. This report is a requirement of the Constitution and includes information about licensing activities for the year. You can take a look at the report at cannabis.mo.gov by clicking on the Data and Reports tile.
Following the first 2 rounds of microbusiness licensing, the Department of Health and Senior Services Division of Cannabis Regulation published a first draft of microbusiness rule revisions to 19 CSR 100-1.060 and 19 CSR 100-1.190 for public feedback. That date closed on January 6th. These revisions are intended to ensure microbusiness licenses are issued to eligible individuals, as required by Article 14, and to address the trend of predatory practices or arrangements in microbusiness licensing. Specifically, these draft rule revisions should mitigate the ongoing efforts of ineligible entities to acquire licenses by taking advantage of eligible individuals. Be looking out for more information regarding the rule-making process by visiting cannabis.mo.gov or through this podcast.
And lastly, we have a staffing change to announce. My boss, Erica Ziegler, has been named the new Deputy Director for the Division of Cannabis Regulation. Erica has been with the Missouri Marijuana Program from the beginning and served as Director for Patient and Application Services for the past 2 years. Amy Moore said, Erica has been at the forefront of many of our biggest intra-division collaborations and external projects, especially during our transition to becoming a department division and the implementation of adult use cannabis. Her dedication to our program, her knowledge and expertise, and her deep interest in people, their well-being and success will be so helpful in continuing to reach our program goals. Erica will officially begin her new role on January 16th, and I am so excited to continue working with her in this new capacity.
I am so excited. So our last podcast, we said goodbye to Andrea Balkenbush, which was so bittersweet.
Right.
I'm so excited for her, but also now very excited for Erica to be our new deputy director.
Yeah.
It's been great working with her since I've been here, and I just look forward to continuing that on. I think she's going to be great for the division.
Agreed.
So
Definitely bittersweet is the way to describe it, because I feel like I learned so much under Andrea, and I'm so, happy that she gets to retire. That's the goal for everybody, right? And
yeah.
now we get to go into a new era per se with Erica as the deputy. And I mean, all good things. It's weird to say that it's bittersweet, but it really is.
Yeah.
I'm excited to see what the future holds.
Me too.
Well, Tara, I think that's a wrap for today.
That was kind of short and sweet. Speaking of which, if you have a topic that you would like to hear on the podcast, please reach out to me. We want this to be informative and reach as many individuals as we can. We're here in our world, and we kind of get self-absorbed with our own work. So there may be things that you want to hear about that we're not even thinking about. So please reach out to me. My email address is tara.mckinney, McKinney, at health.mo.gov. If you have an idea for a topic that you'd like to hear, we'd love to consider what you want.
Yeah, send it our way.
Yeah, you can keep up to date in between episodes. There are several ways that you can stay informed. Subscribe to our email list to receive emails from DCR on various topics and customize them to your needs. Out of all of the different communication, I really recommend that people take advantage of this. It's a really good way to get information. We're not going to bombard your email with a lot of just weekly updates or anything like that. It's really going to be information that's specific to that topic. I know my email box is full of, you sign up for something and it's every day, multiple times a day. We're not going to do that to you. So,
well, and if I can plug that, I've signed up for the mail list, and I definitely think the discernment there is great, because it's information that's useful, helpful, and when it comes out, it's timely and it comes right to you.
Yeah,
love it. Highly recommend the mailing list.
Good. If you are interested in subscribing that, go to cannabis.mo.gov and click on Join Our Email List under Contact Information.
The Cannabis Connection newsletter is published quarterly. It's your information link to Missouri's Division of Cannabis Regulation. It is also one that you can subscribe to, where you sign up and that link comes straight to your inbox every quarter. Highly recommend that. Convenience is key.
Yeah. And that goes back. If you have an idea on what you want to see in the newsletter, you can use that same email address I gave earlier and give me a shout, and we'll see what we can do. For other outreach events and more, always check out our website at cannabis.mo.gov and click on the DCR Communications and Resource tile.
Thanks again, Tara. It's good to be back.
It is. It is really good to be back. And again, just want to say Shane is here with me every other month on those alternative months. Amy Moore, our director, is here with me. I'm looking forward to a new year, and we're here monthly, so be looking out for us. We are currently on YouTube, hoping to branch out a little bit more into Spotify. So be looking out for that coming in the new year.
I'm going to make a playlist as soon as it gets published.
All right. We also have some fancy new pictures out there, if you haven't noticed. We're moving up in the world.
Yeah, so if you were wondering, face with a name, now you can do that. Just check out our cover art.
Yep, that's right. Okay, well, thank you, everyone, and we'll see you next time.
See you next time. Bye-bye.
Bye.
This podcast content is intended for adults over the age of 21 years old and is best to be used for informational purposes only. The content does not constitute official compliance or regulatory guidance. The department and author assumes no responsibility or liability for any errors or omissions in the content of this podcast. The information contained in this podcast is provided on an as-is basis with no guarantees of completeness, accuracy, usefulness, or timeliness. Cannabis licensees should consult with their assigned compliance officer for rules and regulations specific to their facility. The content is not intended to diagnose or treat any medical condition and should not be relied on for any medical purposes. Patients and the public should consult with their healthcare providers about medical-related questions and the impact of cannabis on health. If you believe you are having a medical emergency, call emergency services. The views, thoughts, and opinions expressed herein are those of the authors, presenters, and do not necessarily represent the official views of, nor an endorsement by, the U.S. government, Missouri Department of Health and Senior Services, or the government of the state of Missouri.